Hi, my name is Wan Izzatul Adlina and welcome to my PEC203 Communication Skills reflection video. So, throughout the PEC203 course, I participated in 4 engaging group-led sessions designed to strengthen our communication skills within healthcare settings. So, each group focused on a specific theme, which is communication tools, effective communication barriers, and decision making. So these sessions were not only fun and interactive, but also gave me a practical insight into how communication impacts collaboration, safety, and care quality in clinical environments. So the experiences helped me grow in areas like active listening, decision making, problem solving, and teamwork skills that I know that I will rely on throughout my healthcare career. Enjoy! The first session was conducted by Group 3, focusing on effective communication skills. So this session featured 4 engaging stations. The first, Triage Trouble, required us to evaluate patient scenarios and assign them to the appropriate triage categories, which is red, yellow, green, or black zone. We had to justify our decisions as a group, which encouraged collaboration and clear reasoning with each other. So in the second activity, our X medication match up, we worked together to match illnesses with their appropriate medications. It tested both our medical knowledge and our ability to explain our choices clearly to one another. The third station is Organized Chaos, involved solving a gastrointestinal organ puzzle and writing down the functions of each organ. This task encouraged us to communicate effectively while sharing anatomical knowledge. Finally, Suit Up for Safety required one participant to don PPE correctly while the rest observed and provided feedback based on the training video. So this session taught me that effective communication in healthcare relies on clarity, active listening, and respect for differing perspectives. I contributed by helping with the puzzle, discussing medication matches, and observing during the PPE task. I realized how essential it is to make sure that every message is not only shared, but also understood and supported by the team. Next, the second session, led by Group 2, focused on communication tools, especially for individuals with specific communication needs. The first activity, Guess the Disease, involved guessing medical conditions from verbal clues that became increasingly specific. It trained us to listen carefully, collaborate, and make decisions with limited information that we have. And the second station, which is Braille Medical Mystery, gave us the task of decoding messages written in Braille using a reference chart. So this hands-on activity raised awareness of the communication barriers faced by visually impaired patients and the importance of accessible healthcare communication. And the third activity, which is the silent diagnosis, required us to act out medical conditions without using words or sounds. This station emphasized the value of body language and non-verbal cues, skills we often rely on when treating patients who are non-verbal, have cognitive challenges, or speak a different language. So this session opened my eyes to the wide range of communication methods needed in inclusive healthcare. I contributed by helping decode Braille, interpreting nonverbal cues, and guiding teammates during the guessing game. So it reinforced the idea that effective communication is not always verbal and that we must be adaptable to meet patients' individual needs. Next, the third session was conducted by Group 1 with the theme of communication barriers. The first station, Emoji Throwball, required us to guess diseases based on emoji combinations. After each correct guess, we earned a chance to knock down bottles for bonus points. This game was fast-paced and highlighted how visual communication can be helpful, but also easily misunderstood. And the second station, the symptom match-up, simulated auditory barriers. Participants with disease cards wore headphones while others described symptoms using only verbal explanations. This showed how background noise or hearing issues can disrupt communication and emphasize the need for simplified, clear language. And the final station, The telephone drawing demonstrated how easily a message can become distorted when passed through multiple people. We alternated between drawing and guessing phrases, and the final message often differed significantly from the original, highlighting the danger of unchecked assumptions and lack of confirmation. So this session made me more aware of how barriers like noise, language, and unclear messaging can impact patient care. I participated actively by interpreting emojis, describing symptoms clearly, and trying to preserve message accuracy in the drawing activity. The experience reminded me to always check for understanding and adapt when communication breaks down. Last but not least, my Group 4, presented on a session on decision making. We prepared 2 games, which is Medical Beer Pong and Facts or Acts. In Medical Beer Pong, participants aimed for cups with varying question difficulty, which is easy, mid, or hard. Each correct answer will score different points. This activity encourages strategic risk-taking and teamwork. And the next is Facts or Acts. A spin wheel determine whether players will receive a truth card which contain medical fact or myth, a dare, fun or clinical task, or a bonus point challenge. Participants had to decide quickly, collaborate, and trust no one to earn points. As an organizer, I helped plan the activities, prepare the questions, and manage the game flow. I learned that decision-making in healthcare involves both knowledge and confidence, but also strong communication within the team. Seeing others work together under pressure reminded me of real hospital situations where we must rely on each other to make the best decisions for patients. Looking back on all 4 PEC sessions, I've learned that communication in healthcare is complex and dynamic. It's not just about talking, it's about listening, adapting, confirming, and working as a team. So whether it's choosing the right communication tool, sorting triage cases, navigating barriers, or making fast decisions under pressure, every session taught me something valuable. I now feel more confident in my ability to communicate effectively with patients and my colleagues. These sessions helped me grow as a team member and future healthcare provider. And I understand that every patient and situation is different. And as a communicator, I must be flexible, empathetic, and clear. These are lessons I will carry with me into every clinical encounter. Thank you for watching my video.